Wikidontist.com. Truth about tooth.
Hi, I'm Dr. Thomas Najipada and this is Wikidontist, and today we are going to talk about instructions to the orthodontic patient. Orthodontic patients are there across the world, and there are different instructions which is given. This is a simple video which you can understand each and every instruction which you need to follow as an orthodontist. This is what we give in my clinic. So I'm an orthodontist who is practicing in Cochin for the past 16 years. My dad is another orthodontist who has been practicing for 40 years. So welcome to my channel. If you are seeing me for first time, please subscribe and personalize it by clicking that bell icon. So when an orthodontic patient comes and starts the orthodontics, once it is started, what all are the different instructions which we usually give? If there are some extractions and things like that, there is another video which tells you about the extraction, and if you are taking out a tooth, what are the instructions which are specifically for them. Otherwise, it is basically for orthodontic patients too. What all are the instructions? One is to keep it clean. So you have to brush it and keep it clean. That's one of the best things that you have to do while doing orthodontics. Keep your teeth clean. After every meal, you have to wash. You cannot use the tissue. You have to wash and keep it clean. One. Second thing is you have to brush twice daily. That is, once after the breakfast and once after dinner. You need to brush it. Why we tell you it is very important is because since you have brackets all over your teeth, so what happens is there are areas around the bracket where the food can get lodged, and this can cause white lesions around that bracket. So we don't want that to happen. Some of the orthodontists gives you a fluoride mouthwash, which will also reduce your white lesions around your bracket. So there are other techniques which we can use to reduce the white lesions which we are doing in our clinic, but to reduce your caries activities and also the white lesions around the bracket, please make sure that you brush your teeth twice daily and wash after every meal. So this is what we'd like to tell you as first. Second thing is to go to the orthodontist as instructed. Some orthodontists call you for review every month. Some people review for once in 3 months. Some of these new techniques like fast braces, they need reviews after every 15 days. So so please make sure that you go at the exact time. Otherwise, you will get your treatment delayed, your expected outcomes delayed, because the expectations will get delayed, or even sometimes the plan of the treatment also can change. So please make sure that you go in the right time when the orthodontist asks you to go. Third thing is to avoid hard food. Hard food means it is not to use all liquid food. It is always to use something like so you can eat everything other than crackers. Crackers means whatever is put in your mouth, if it is making a cracking sound, please avoid it during your orthodontic treatment. There are people who can chew it in the last teeth and manage somehow, but it is very risky to use it because it will actually nick the teeth, nick the wires, or it can even distort the wires and give you undesired results. So if most of the time, please avoid any crackers in your mouth, because that will reduce your movements, that can actually take off or knock off some brackets, and that will also increase your treatment time. It can also give you troubles in getting the tooth moved in the right direction. So please avoid crackers. That is hard food which should not be eaten during this orthodontic period. Then what else? Please make sure that you if you are given some extra appliances like elastics, we don't give much elastics nowadays, but if you are given an elastic, please wear it as proper. There are orthodontists who give bite planes and things like that which are removable. Please make sure that you wear it as instructed. If there is a headgear or an extra oral appliance, please wear it. We can actually we can actually avoid extra oral appliances because of the implants and things like that. But if it is given by an orthodontist, please make sure that you wear it and get all these treatments in the proper way. Please make sure that you plan ahead, that the treatment time given to you is an average, and please make sure that you consider around plus or minus 5 months, because sometimes your hormones and things like that can change your this thing. Please avoid very sugary and very sticky food, because your bands which are already there, the sticky food can actually dislodge it, and then the very sugary can actually seep in between the bands and then also cause caries and things like that. So we want you to have very good teeth even after the orthodontic treatment. So please make sure that you avoid very sticky food. First I told about hard food, now I am talking about sticky food, because some of the bands and things are actually stuck onto your tooth. It can actually get dislodged, and then whatever food can actually seep in through, and even if you don't know, still it can actually, if it is broken, if there is a tooth which is broken, the bracket which is broken, please go and visit the dentist as early as possible and fix it back. The orthodontist has to see you and fix it back, but it can actually delay your problem. So all these things, if it is maintained properly, if you can go and show the orthodontist correctly, your treatment will be much better. If at all you have some problems, please make sure that you call back and then get your treatments done. If you are traveling to a distant place, please inform the orthodontic office and ask them what can be done. Can we increase your this thing if you are getting it delayed for. So if at all your appointments are delayed, please reschedule. Please call up and reschedule and then take it further. So all these things will improve your treatment quality and also reduce the treatment time. And if you can be disciplined, and if you can go to the orthodontist and have a very good relationship with the orthodontist, you will have a very pleasant and very painless orthodontic treatment. Thank you very much for watching. I am Dr. Thomas Nechipadan from Nechipadan Dental. If you have any queries, and if you want more things to be understood, and if you have some instructions to me, or if you want some comments, please make sure that you put it in the comment box so that I can answer you and give, or even if it is a very good topic, I can even put a video for you. Thank you very much. Please continue watching and referring more people to this video so that they can also have a great and beautiful smile with all my dental videos. Thank you very much. I am Dr. Thomas Nechipadan from Nechipadan Dental at Marine Drive, Kochi.
Wikidontist.com. Truth about tooth.